Okay, the first thing I'm going to do, as with any patient contact, is make sure that I wash my hands well. So I have my safe water that I've brought with me. I'm going to wash with soap and water. When my hands are dry, I'll put on gloves if I have them available. If you don't have gloves, you can use plastic bags to cover your hands, or even rags, anything that will protect your hands from the blood and the body fluids that you'll be dealing with. I want to expose the wound, which may mean that I'll cut away some of the fabric that might be involved in the injury. I need a bright light. In our medical bags, we have a headlamp that you can wear that will help to show up the area that you're working at to make sure that you have it clean. Make your patient as comfortable as possible. Wash the skin around the wound area with soap and water. And prepare your supplies to clean and cover your wound. So these are my supplies. This all comes in my wound care kit. I have my gloves here, have a basin to irrigate into, have my soap and my rags. I have cleaning solutions here to be mixed with my clean water. I have bandage scissors, and I have opened and laid out all of the dressings that I'm going to use. I'll have these to scrub with. This for the first dressing, a second dressing, and then an outer dressing to protect the wound. Now I'm going to mix up my cleaning solution. We have 1 liter of clean water, so this has been boiled for a minute, poured into a clean container, and it has a clean lid on it. I'm going to mix that with one of these other additives that's an antimicrobial. So you can either use vinegar, or Clorox, or salt, or betadine, one of these 4. I'm going to use betadine because it's easier to see that when I add it to the solution. So I'm going to have 2 capfuls of betadine. This stuff is really messy. Whatever you get it on, it will stain. So this solution can be used both for the mechanical scrubbing and also for the irrigation. So this is our mixture for our cleaning solution. We're going to put some of it in the basin, and this will be used for the mechanical scrubbing. And some of it's going to go in the bottle for the irrigation solution. We want about 500 cc's of irrigation solution to make sure that we get the wound good and clean. I've cut a small hole in the cap of this bottle. And we'll use this to squirt and clean the wound out, and this provides pressure and gets all of the debris out of the wound. Okay, our first step is to clean this wound as well as we can with soap and water. You would want your water to be clean water that has been boiled for a minute, cooled, and put in a clean container. So we're going to take soap and water. We're going to do the best we can to clean this up. And then we're going to use the solution that we've mixed to do more mechanical cleaning. I'm going to start in the middle of the wound and then go to the outside. Clean part first, and then around to the dirty, and throw this away. And get another clean sponge. Do the inside first, and then around to the dirtier part of it, and throw this away. Get another clean sponge. Do the center first. Around the edge. And throw this away. This will get a lot of the germs out of the wound, but the best way to clean germs out of a wound is with irrigation. So we've prepared our irrigation solution already. I'm going to just squirt this fluid in here, and that helps to push all of the germs out of the area. If it's a badly soiled wound, you should use a full 500 cc's of irrigation solution. If it's not real dirty, you can use 300 or 400 cc's. This pressure is what gets the germs out of the wound. Okay, after you've used your 500 cc's of irrigation solution, you can pat it dry, and now you're ready to put the dressing on. We're going to have 3 layers of dressing. This is the first layer. I'm going to put my antibiotic ointment on this dressing and then apply that to the wound. You don't want to use your antibiotic ointment on the wound itself because that will contaminate the tip, and then it's not usable for somebody else. So you put the antibiotic ointment on the dressing, then put the dressing on the wound. The second layer would be a bigger dressing. And we might want to tape that down. And then the third dressing is a covering, just to keep it clean and make sure that the dressing stays intact. You want to tell your patient that he needs to come back in 2 or 3 days. Let you check it for signs and symptoms of infection. Teach them about signs and symptoms of infection and when you would need them to come back or go to a higher level of care. Okay, now after we've put the dressing on, we want to check and make sure that there's good circulation in the extremity. So we have the patient wiggle their fingers, make sure that they're nice and pink. You squeeze the finger and see if there's a blood supply in the tips of the finger. Make sure you can get at least 1 finger underneath the edge of the dressing. If that swells and becomes more tight, the patient can take the dressing off, loosen it a little bit, and then reapply it. Okay, just to review, we have 2 different methods to clean the wound. The first method is mechanical cleaning, which you can do with soap and water, or you can do it with your dressings in your solution. The second method is irrigation with the bottle under pressure. That's the most effective way to remove germs from the wound. Once you've dressed the wound, if you have an ACE wrap available, this is really good just to protect it from dirt. Also, the advantage of using an ACE wrap is that you can wash this and reuse it, so the patient will have this at home for another time. Once it's dressed, you want to tell your patient to come back in 2 to 3 days, unwrap the wound, and check it for signs of infection. Signs of infection would be increasing size of the wound, increasing pain in the wound, redness, warmth around the site, a foul odor, thick, non-clear drainage, or running a fever. If any of those symptoms appear, you want your patient to let you know right away. One advantage to rechecking the wound in 2 or 3 days is you've had an opportunity now again to pray for that patient and to witness to them and share the gospel. We hope this presentation has been helpful to you, and thank you for watching TTT.